Welcome back to Africa's Science Focus, the weekly science and development show from SciDevNet. I am Ogechi Ekeanyanwu. Spina bifida is a birth defect causing malformation of the spinal cord. It results in damage to the spine before birth and often leads to complications that can cause death, particularly in Sub-Saharan Africa, where it can be difficult to get access to adequate healthcare. To find out more about spina bifida, we spoke to Dr. Ifeanyi Nsofor, a public health physician, a global health equity advocate, and senior New Voices fellow at the Aspen Institute, Washington, D.C.
Spina bifida is a malformation of the spine. It happens when the neural tube, which is what eventually forms the brain and the spinal cord, does not develop properly. And in this instance, along the spine, neural tube doesn't close. It's usually seen at birth, especially for the severe ones. But for the not so severe ones, it may be noticed due to some physical issues that a child has after birth. And of course, the severity of spina bifida would depend on where the opening is along the spine. So if you have spina bifida, the severe ones, where the spinal cord and even some spinal nerves, protrude through this opening along the spine, you would have very severe consequences. I mean, in those situations, someone may not be able to walk. Someone may not be able to control the reflexes for urination and defecation. So the severity of spina bifida would depend on what type of spina bifida that exists.
Why does it happen?
One of the commonest reasons why spina bifida happens is because of the lack of folic acid. Folic acid helps with the development of the neural tube, ensuring that it develops properly, it closes when it's supposed to close, and there are no defects along the spine. And this is why it is very important that people take folic acid, especially women of childbearing age, especially women who know that they want to have children, not long from now. It's advisable that they are placed on folic acid.
What is the prevalence rate in the region?
Spina bifida is quite prevalent across Africa. A recent survey by ResearchGate shows a prevalence rate of 0.13%. And that means that out of 1,000 children born, about 130 would have spina bifida. So it is quite prevalent in Africa and is really an issue of public health concern.
The consequences of spina bifida can be severe. We spoke to Lawrencia Dyawei, a fashion designer based in Lagos, Nigeria, and the mother of a child with spina bifida, who told us about the challenges her child and her family face.
Caring for the child, it took a lot of effort, a lot of time, and a lot of money. We were admitted in the hospital and surgery was booked. But before the surgery, we had a challenge. She had some blood deficiencies. So we were kept in the hospital for 2 months and they were boosting her electrolytes and all the deficiencies that were there since they were not up to the level where she could enter a theater. So when the boosting was done, she was booked for surgery and the surgery was done when she was 10 months old. Yes. After the surgery, because they told me that the probability of her using her legs was 50-50. I didn't give up. I keep trying and I kept trying and I asked the doctors what I could do. They told me they would refer me to a physiotherapy department where they should be looked into, but they were still not guaranteeing me that she was going to be okay, but I should just try, and I accepted. So I resumed physiotherapy with her when she was 1 year, 2 months, and we started the physiotherapy. After a short while, her muscles became strong, and when she was 1 year, 10 months, she started walking. We kept going for the physiotherapy. After like a year of physiotherapy, she was declared fit to walk. So we were discharged from there. But after then, I noticed that she couldn't do without diapers because we have to be wearing her diapers always. I complained to the neurosurgical department. They told me that they had explained earlier that the lower part of her body wasn't sending signal to the brain. So I was also referred to another clinic, a CIC clinic, where they do clean intermittent catheterization. So we attended the clinic, and there I was trained on how to take care of her, how to catheterize her, how to do a bowel washout for her so that she could be able to use the toilet, since she couldn't do it by herself. There was no signal, so she wasn't feeling when she needs to do clear her bowels or when to urinate. So I took the training, and we've been on it till today. We've been on it. But along the line, she started feeling the need to clear her bowels by herself. So she started, that one was settled. Till today, she goes to the toilet by herself. She could use the toilet by herself now. So the only issue we have now is the fact that she can't urinate by herself. So the girl is 6 years old now, and she's doing well in school. Her brain is intact. Her learning ability is normal. She learn like other children. She play like other children. In fact, she mingle with other children.
We also spoke to Festus Fajemilo, co-founder and executive director of Festus Fajemilo Foundation. It supports people with spina bifida. He spoke about the prevalence of spina bifida in Sub-Saharan African region and what can be done to better meet the needs of children with spina bifida and their families.
The financial burden is so huge in terms of management, and that's why government in developed countries, there is early intervention, and they attach much importance to prevention. But in this part of the world, where this is situation by, a child is detected to have a birth defect, the child is delivered in a public hospital, and child, because the parent do not have the financial, capability to, pay for treatment, the child is discharged, left to, is our fate. And the treatment for them is multidisciplinary. Okay, so a child with spina bifida, maybe is identified by a paediatrician, and it goes to neurosurgeon who repairs the defective, deformed spine. From there, such a child may also have deformed lower limbs. So he or she needs to see an orthopedist, for corrective surgery. Then they have issue with bladder and bowel incontinence. They need to see continence specialists. No, so it's a whole lot of treatment that they need to see, and we don't have a system here whereby all these professionals are in one place. So you see a parent, taking a child with spina bifida from one hospital to the other, and so it's very, very challenging. But in our foundation, we are able to, through our support group meeting, families come around, we share experience, we share knowledge. We're able to lift their spirits. Despite all these challenges, your child can still be who or she wants to be. So if prompt intervention is provided, there's support from home, there's show of love among, people in the neighborhood, then the child can thrive.
So what kind of interventions should be in place by African leaders now, looking at the continent?
Like I did mention, treatment is multidisciplinary. So we need a multidisciplinary system to be in place, whereby I've seen that, in the UK during my, common professional fellowship. I visited 2 hospitals, one at Chelsea. So where, all the professional specialists are in one hospital. So it may take you a whole day, but you see every specialist that you need to see. And so at the end of, the day, you are not coming back to that hospital. You are referred to your local GP. We also need funding. So we need funding, adequate funding to be provided in public hospitals. If a child, with spina bifida is born, in most countries I've visited, that child is not allowed to go home. The system treats the child whether the parent has money or not. But here, the child is sent home once the parent cannot, pay for treatment. And the specialists will tell you that treatment for spina bifida hydrocephalus is yesterday, not even today. Meaning that as soon as the child is detected, treatment should be done. Their time should not be wasted, because each day the brain its function is distorted.
With proper interventions, many cases of spina bifida can be prevented. Dr. Joyce Mwatonoka, a pediatrician at Benjamin Mkapa Hospital, Dodoma, Tanzania, talked to us about these measures.
So this defect usually occurs when in utero during the 4th week of pregnancy. So by the end of the 4th week of the pregnancy, it has already occurred. During which time most women still don't even know that they are even pregnant. So this actually poses one of the difficulties in preventing it, because by the time a woman realizes that she's pregnant and she wasn't taking any measure to prevent spina bifida, it has already occurred and you can't do anything after the 4th week of life. So how can we prevent spina bifida? As you've seen, one of the commonest, one of the biggest risk factors is deficiency of vitamin B9, which is folic acid. So supplementation with folic acid at least 3 months before conception and at least in the first 12 weeks of pregnancy is very important in preventing spina bifida. It is estimated that when you do this, you supplement folic acid prior and during the first week of pregnancy, you prevent at least 7 out of 10 cases of neurotube defects, including spina bifida. And also, we have seen other risk factors, so like avoiding taking medications which are associated with increased risk of spina bifida during pregnancy, and maintaining a healthy weight, that is avoiding obesity, and also making sure to treat mothers who are diabetic. What should policymakers in Africa do to prevent or reduce the burden of spina bifida in the continent and also in my country? I think the most important thing here is the continuous, and I'm emphasizing the continuous because we usually have these health education campaigns which just come in a week and then they disappear for years. So, and you can't get everyone, on the first day. So they have to be continuous health education to increase awareness on importance of family planning and folic acid supplementation prior to conception. As you saw, folic acid supplementation prior to conception and during the first weeks of pregnancy is very important to prevent spina bifida. So, and you cannot be taking folic acid before pregnancy if the pregnancy is not planned. So family planning is very important, and supplementation of folic acid. I'm also emphasizing this because actually most pregnant women would come and book their antenatal clinic usually when the pregnancy is around 2 to 4 months. You rarely get pregnant women coming to book when the pregnancy is maybe a week or 2 weeks, because again, most of them still even don't know if they're pregnant. So it's very important to start to do the family planning and to start the supplementation prior to conception to avoid at least decreasing the risk of getting babies with spina bifida. Another thing is, since it's difficult to, I can say, generally do family planning, especially in our countries, developing countries, the best way the government or the policymakers can do to ensure that all women get folic acid supplementation before pregnancy is actually by doing food fortification with folic acid. So we could fortify sugar or flour, something which everyone takes, so that we ensure at any time all women are getting folic acid, which can help them prevent to have babies with spina bifida.
That's all from us at Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hurst, with editing and hosting by Ogechi Ekeanyanwu and reporting by Ijeoma Ukazu. I am Ogechi Ekeanyanwu. Until next time, goodbye. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station.